Red Cross to be able to ask about a tent.
It was supposed to be a day the province would talk about hope and unveil its vaccine rollout program set for the new year. However, a new report shows that the province may be preparing for a grim reality in the meantime. According to a CBC report, a federal source says Alberta asked the federal government and the Red Cross to supply field hospitals to help offset the strain on our healthcare system. Health Minister Tyler Shandro says it's a contingency plan.
Something that is currently we see being needed. It's not in our current plans, but to make sure that it could be a plan that's potentially used in the future, that's why there's the conversation with the Red Cross to at least secure that tent at this time.
When asked if this potential need for field hospitals meant that the province had failed to manage the pandemic in the province, the Premier says,
"No, I think it's a sign of responsible planning on our part. In a system with 100 hospitals and 8,500 beds, where we believe we can dedicate 2,300 of those to COVID patients. We currently have a little over 500 patients. So while there are about 16 hospitals under significant stress right now, and a lot of healthcare workers are exhausted, the reality is that we have and can continue to create capacity as we expect. Quite bluntly, the hospitalization numbers to go up, given the new cases in the last few weeks.
The positivity rate of COVID tests in the province rising again to 9.2% as 1,685 cases were reported from over 18,000 tests. 10 new deaths were reported for a total now of 561. 504 people are in hospital with 97 in the ICU. The vulnerable population and healthcare workers will be the first to receive the vaccine, with a rollout likely starting early January.
We anticipate that we will be able to administer vaccines to approximately 435,000 Albertans. That's a little more than 10% of our population. Both the Moderna and Pfizer vaccines require 2 doses to be fully effective, separated by 3 to 6 weeks.
The Premier says those vaccinated in Phase 2 between April and June would be decided by COVID Vaccine Task Force, which will be headed by Paul Winnick, who is the Deputy Minister of Municipal Affairs. He says the general population will have access to the vaccine by next summer.